Hi. So we just concluded your examination, and let's talk a little bit about stress urinary incontinence. So it is essentially leakage of urine that happens with strenuous activities such as coughing, sneezing, or straining in the absence of a bladder contraction. So the typical female anatomy, as seen here from the side, is this is the head end, this is the foot end, this is the front, this is the back. This is the pubic bone in front, the bladder, the urethra, the vagina, the uterus, and the rectum at the back. So the urethra is supported by its own sphincter and also the pelvic floor muscles. And that's what keeps these organs in place. The bladder fills up with urine and the urethra remains closed as it's filling up. Now, the only time that the urethra and the sphincter opens up is when you are urinating. You see, now it opens. So that is the classic mechanism of urination. The dotted line here is where the bladder and the urethra are at rest, or were at rest in this case, and should have remained there. So the bladder should have remained there, the urethra should have remained there if the muscles and the ligaments were strong enough. When she coughs, it should not have fallen back, but if the ligaments are lax, the urethra and the bladder junction falls back, funneling it open, resulting in urine leakage. That is classically called hypermobility. So you can see the urethra is straight. When she strains down, the urethra falls back, and that increased angle of the drop results in urine leakage. Now, sometimes it may be also associated with a weak urethra. And I may have told you already at the urodynamic testing whether your urethral sphincter was good or weak and what did it show. It's very common, so you are not alone. 1 in 3 women, at least 1 in 3 women have this problem. And it's young women, the 30s, the 40s, and the 50s who have this problem. So thank you for doing a good job with your history forms that you filled in, and we reviewed that with you, including the impact on sexual function. And then we did the examination already. We did urodynamic testing and looked inside the bladder. Now the next step is, I'm not sure, based upon your history, I may ask you to do the 24-hour diary along with we measure it in this hat, and then just don't collect it, just measure and throw it away, and do a 3-day diary. What are the next steps? Your point of care person who you already talked to will be coming in a few minutes, and she will connect with you in a few days, next day, in fact, tomorrow, to check on, see how you're doing. And if you had any questions from today's visit, any discomfort or anything like that, then she'll set up a date and time to review with you after you have watched the management video that I'll tell you in a minute how to do it. You've sent in your diaries, and if applicable, and then sent in your Q&As based upon the management video. That'll help you. She'll also help you set up my chart if you don't have it, and doxy.me. This is for the virtual. So I can in fact do your visits now virtually. Now, physical examination has already all been done. She'll set up a preview call with you to make sure all that is in order, and then schedule you for a consult visit with me. So your role for the next steps is to finish watching the pertinent videos, send in the feedback Q&As for that video, set up my chart if you haven't, doxy.me also, then the preview meeting with your POC, and any medical clearance that you need. If I've told you that you need it, let's say you're on a blood thinner, then that would have to be required before we do anything, and set up a consultation meeting with me. So that's important. Now, this can happen afterwards, but these things have to happen. Once you have the preview meeting, she'll get you for a consult. Now, my goal is to get you in immediately. As soon as you get your part of the deal done, the diaries, the videos watched, you do this stuff in, I will get you in within a week or 2 weeks for a consult visit. Now, many a times we may be able to do the consult visit remotely, virtually, if you've done the mock in the office, and we'll talk about that mock today. Most patients, it's like a mock of the procedure if we had to do that. Most patients have waited too long, you have waited too long, now enough of waiting, let's get this resolved. So stress incontinence is very common. The treatment has improved dramatically, and once you watch this, you will know something, but let me just give you a little flavor of what to expect. With my technique, the my DIST procedure, there's a 95% chance of cure, at least 95, if not 100% cure, that you're not leaking with coughing, laughing, sneezing. And it's entirely done under local anesthesia, and there is minimal downtime. And when you watch it, you'll understand more about it. So bottom line, stress incontinence is common and 1 in 3 women have it. It's more the younger women who have it, but absolutely no to pads. As most common regret of our patients is why I wish someone had told me about this earlier. And that's what they say. It's not that she did not know this. Someone should have told her about this. So now that you know, why would you wait? Get your life back and say no to pads.